Hello, I'm Dr. Evelyn Reed, and welcome to the Florida Elder Care Training Series. One of the most confusing and upsetting aspects of caring for someone with dementia is witnessing changes in their behavior. Someone who was always patient might suddenly yell. Someone always proper might start using inappropriate language. It's crucial to understand that these actions are symptoms of the disease. They are not intentional. They happen because dementia physically damages the brain. Think of it like a radio with static. The person you love is still inside, but their brain is having trouble sending and receiving the right signals. Understanding why these behaviors occur is the key to responding with patience, kindness, and effectiveness. Today, we will explore these common changes and how to manage them. When a person with dementia acts out, they are almost always trying to communicate something they can no longer express with words. This is the most important concept in dementia care. All behavior is communication. Let's look at the root causes. First, the physical brain changes. Dementia damages different areas of the brain. For example, damage to the frontal lobe, the brain's filter, affects judgment and impulse control, leading to inappropriate actions or loss of inhibition. Damage to memory centers causes repetition. Second, difficulty communicating. As the disease progresses, the person loses the ability to find the right words or understand what you are saying. When they can't express basic needs, frustration builds and often manifests as agitation or outbursts. Third, confusion and overwhelm. Disorientation about time and place is frightening. They may not recognize where they are. Furthermore, their brains have difficulty processing too much information. Too much noise or activity can be overwhelming and cause distress. And this one is crucial: physical discomfort or illness. This is the most common trigger for sudden behavioral changes. Are they in pain, hungry, thirsty? Do they need the restroom? A urinary tract infection, or UTI, is a very common culprit that can cause a sharp increase in confusion and agitation. Always investigate physical causes first. Let's explore some of the common behaviors you might encounter. Repetitive actions or questions. Asking the same question over and over, like, "What time is it?" This happens because short-term memory loss means they genuinely forget they just asked. They might also be seeking comfort or reassurance. Agitation and restlessness. Fidgeting, pacing, or an inability to sit still. This often stems from discomfort, boredom, feeling overwhelmed, or an unmet physical need. Aggression, either verbal or physical. Yelling, striking out, or strongly refusing care. This is almost always rooted in fear, pain, or feeling threatened. During personal care, like bathing, they may feel exposed or violated and perceive your help as an attack. Wandering, trying to leave the house or walking aimlessly. They might be restless or looking for something familiar, perhaps trying to go home to a house they remember from childhood, or trying to follow an old routine like going to work. Sundowning. This is increased confusion and agitation occurring specifically in the late afternoon or evening. This can be caused by fatigue, changes in light confusing their internal clock, or shadows causing fear. Hallucinations or delusions. Seeing things that aren't there, hallucinations, or having strong false beliefs, like thinking someone is stealing, delusions. And hiding or hoarding objects. Putting things in unusual places, like keys in the refrigerator. This often stems from feeling insecure and trying to keep items safe. When a challenging behavior occurs, reacting emotionally can escalate the situation. Instead, we use a thoughtful approach: investigate, distract, and reassure. Step 1. Investigate. Be a detective. Try to figure out the why. First, check for physical needs. Ask, are you in pain? Or, do you need to use the bathroom? Next, look at the environment. Is it too noisy or chaotic? Finally, what is the message behind the behavior? If they are pacing, are they bored or anxious? Step 2. Distract or redirect. Gently shift their focus away from the distress. Offer a favorite snack or play familiar music. Suggest a simple task they enjoy, like folding towels or looking at old photos. Sometimes moving to a different room, a change of scenery, can reset their mood. Step 3. Reassure. Provide comfort and safety. The most critical element here is your demeanor. Stay calm. Take a deep breath. Your anxiety can easily transfer to them. Speak slowly, in a soft, even tone. Validate their feelings. Even if what they are saying isn't true, the emotion behind it is real.
Senior, I need to go home. My mother is waiting for me. Caregiver, I see you are missing your mother. She sounds wonderful. Tell me about her.
The caregiver didn't argue that the mother is deceased. Never argue. Logic and reasoning do not work when the brain is affected by dementia. Arguing will only increase distress. Focus on connection over correction. While these strategies are effective, there are times when you must seek professional help. Contact their healthcare provider if Managing behavioral changes in dementia requires patience, creativity, and a deep well of empathy. By understanding that these behaviors are communication driven by the disease, we can shift our approach from frustration to investigation and reassurance. Remember, they aren't giving you a hard time. They are having a hard time. Your calm and compassionate response is their anchor. Thank you for the incredible work you do.